So what is dandruff or seborrheic dermatitis, and why does it happen? At its core, dandruff is your scalp shedding skin cells too quickly. It's often mixed with oil, creating those classic white or yellowish flakes. And one of the main culprits is a yeast called malassezia, which lives on almost everyone's skin. In some people, though, it triggers inflammation and irritation, and that's when dandruff actually flares up. Other factors that make the scalp more vulnerable include excess oil production, sensitivity to hair products, dry or cold weather, and of course, stress. So, from a conventional view, dandruff is seen as a local scalp issue, a combination of yeast overgrowth, inflammation, and skin barrier disruption. How do we approach it in conventional medicine? Well, in conventional dermatology, the goal is to reduce the yeast and calm inflammation. And that's why treatments often include medicated shampoos, which you've probably seen at the drugstore. So let's go over them. First, we have Head and Shoulders. Zinc pyrithione, the main ingredient in Head and Shoulders, works as both an antifungal and anti-inflammatory agent, and it helps control yeast and soothe scalp irritation. Then we have selenium sulfide, like in Selsun Blue, and that is also an antifungal. And plus, it slows skin cell turnover, which helps reduce flaking. The next one is ketoconazole, for example, in Nizoral shampoo, an antifungal that directly reduces malassezia yeast on the scalp. There is also prescription ketoconazole that is stronger. So if the scalp is very inflamed or scaly, I may also prescribe a mild topical steroid. And I also actually recommend alternating medicated shampoos with gentle moisturizing ones to avoid overdrying of the scalp. And because one of the most annoying problems with these shampoos is that they do have a drying effect on the scalp. So in terms of the hierarchy of shampoos, we start with recommending Head and Shoulders, and then ultimately moving up to prescribing 2% ketoconazole shampoo if there is no improvement. Overall, this approach with shampoos and topical steroids can bring quick symptom relief. Flakes lessen and itching comes down. But here's the catch. It often doesn't address the underlying why, and that's why many people find their dandruff returns as soon as they stop these treatments.